on mass health,
Oh, shoot.
for stakeholders and partners. So with that, I will hand it over to Elizabeth.
Share with all attendees afterwards. I just want to encourage folks to take the time to absorb the information, go through the slides, and that the MDDC policy team is here to talk with you about it as you process that information. We will also kind of be thinking of additional questions we have to ask Elizabeth. So as you review the information in the slides, or if you have additional questions that you think of, please feel free to communicate those with us. And we will make sure there's a direct line of communication to Elizabeth so we can get all our questions answered. We know it was kind of a quick turnaround, and maybe some folks might think of questions after the fact. So yes, please stay in touch with us about this presentation. We might even have time at the end if folks think of questions that they wanted to learn or know more about. And that's what I have for
Oh,
us.
thank you, Caitlin. So now we'll go back to our regular programming. Next is state legislative updates, and I'll pass it on to Jennifer to update us on state legislative activities.
Thanks, Jossie. Okay, so where are we at in the state legislative process? We have about 3 months to finalize bills, but right now the state budget is really a key focus now through the end of June. The formal session closes on July 31st, 2026. All right, let's go to the next slide. At this point, all of our MDDC priority endorsed bills have had a hearing. We'll drop a link to our website. I want to throw out some thanks to my colleague, Jackson Crilly, who updated the bill status on our website. So you can go to our website to view all of our endorsed and priority bills. So some bills, bill reporting dates have been extended. The last time we met, they had been extended in March into mid to late March, and then now we have bills being extended to June 15th. And we will also be posting this slide deck, the MDDC Public Policy Committee meeting slide deck, on our website, and the links to the information on the slide are in the slide, and you'll be able to access it there. There are two policies that have become law. There was an education access policy, and then the historical records policy as well. So, there's still time and things are moving through. There are many bills in Ways and Means right now. I do want to highlight a couple of bills that have been moving since we last met. Next slide. So the first bill I want to talk about is one of our priority bills. It's the bill that would enhance the standards of care for those with autism and intellectual and developmental disabilities. This bill is about creating an integrated state plan to develop training and education for healthcare providers, as well as establish some appropriate standards of care as well. We have Representatives Garbely and Barber, and also Senator Lewis, who are bringing this bill forward. And you'll notice downstairs, down at the bottom of this table on the slide, the Senate version of this bill was reported favorably by the Joint Committee on Healthcare Financing, and it was referred to the Senate Committee on Ways and Means. And this happened back on April 2nd. If you wanted to go back and watch the public legislative hearing for this particular priority bill, you can do that in that box, the orange box to the right. It'll take you to the General Court website page where the recording of the hearing is there. If you wanted to, revisit that hearing, who testified and what they had to say. So this is definitely a positive development. And the fact that most of our bills are still active within the legislative process is certainly very promising. Let's go to the next slide. So there are a couple of priority bills that have been sent to study. The first one that I want to talk about is the Act to Protect Medically Fragile Children. Now, I want to note while the Senate bill was sent to study, the House bill, House 1366, that reporting date was extended to Monday, June 15th. As you might remember, I'm just going to my note here. Yes. As you might remember, this particular bill aims to ensure kids and adults with complex medical needs that they receive continuous skilled nursing services as authorized by Mass Health as medically necessary. So this is a really important bill. We know that there's been a shortage of highly skilled workforce to be able to support the care and needs of individuals with medically fragile conditions. We know that low reimbursement rates are one of the barriers to provide access to these services in the community. And we know that there are some pretty high staff turnover rates. So this bill is really important to help ensure that those individuals can receive the care that they need. So as I said, and if you go on our website, you'll notice that that reporting date was extended to Monday, June 15th. Now, the next bill I want to talk about, an act to prohibit discrimination against adults with disabilities in family and juvenile court proceedings. Both the House bill and the Senate companion bill were both sent to study. This is not the first time that this has been a priority bill of the Massachusetts Developmental Disabilities Council. In my time here, this is the second session that we have been working to educate and inform lawmakers about this policy. And I'm just going to bring up my note for that one. This bill was aiming to ensure that the court was using evidence and not making assumptions about individuals with disabilities when making decisions in the family and juvenile court proceedings. So, you know, oftentimes lawmakers might have some concerns. They might feel like, you know, this bill is not quite ready for prime time yet. So it doesn't mean that they don't recognize that this needs some attention. And I am just guessing here, but oftentimes in this type of a situation, based on my professional experiences, you know, policymakers are feeling like it's not quite right yet, and it's not quite ready for prime time. All right, any questions so far on those bills? The next bill that I wanted to talk about was the Act expanding wheelchair warranty protections for consumers with disabilities. Liz, do you know if Destiny Maxim was able to pop into the meeting yet?
I'm here.
Yep.
Oh, yeah. We're a little ahead of schedule, Destiny. Well,
No.
I'm really grateful that Destiny Maxim is here. Destiny, what's your official title at Disability Policy Consortium?
The community organizer.
Community organizer. I met Destiny through the Generational Leadership Summit. Not only is she a graduate and alumni from the GLS Summit, but she also has been a presenter, and she's helping to plan the alumni reunion for the summit as well. Destiny has been a very important face to this issue, and she has done some very exciting work to help educate and inform policymakers. So we're so happy you were able to join us today. She's going to share some good news about this particular policy that happens to be an MDDC policy, priority policy as well. Thank you, Destiny.
Thanks, Jennifer. Hi, everyone. I'm Destiny. As Jennifer said, I'm the community organizer over at DPC, and my main priority is getting this wheelchair bill passed. So going off of a similar way that Jennifer did, this bill did start out as H1278 and S210, and they had two very different, they were very different from each other, the House version versus the Senate bill. At the time, the House bill is the one that was mirroring what happened in Connecticut. So it was aiming to not only define but also enforce a repair timeline of 10 business days for the repair to be complete, and then 3 days for parts to be ordered. And sadly, what's actually in the bill language is also mandating that they call you back within 1 day to let you know that that's how much of an issue this is. We had an early hearing at the end of April that had a remarkable turnout of people. We had over 2.5 hours of testimony just on the wheelchair repair, and testimony is only 3 minutes long, so that can tell you how many people we had in support of this bill. After that hearing, we actually heard from the Senate chair, Senator Payano, that they thought it might be best if we thought about consolidating the bill into one bill. So that's what you see on the screen here, the change from H43 or from S210 to S2662. We actually completely changed that language and made it mirror the House bill. So instead of it being the wheelchair warranty bill that most people are familiar with, it's now the same as the House bill. So again, it's defining and enforcing a repair timeline of 10 days. Both of these bills advanced out of committee, and we were very shocked and happy to see that it went out of a second committee. It didn't go straight to healthcare financing or anything. It went directly to Ways and Means on both sides. So what we're doing now is we've got a meeting with the chair and the Senate vice chair for S2662 to talk a little bit about what we hope to see it get through. And we're very lucky that we have a very strong support in the Senate. In the Senate side, it has passed twice already. So our main focus is on the House. And we're also lucky that we've got Repo Day as our lead sponsor behind the House bill. And a little bit of an update there is we're actually putting out the Repo Day is putting an outside section to the budget. So it's an amendment number that's going to give an opportunity for the bill to be heard in front of the House. It's a possibility that it might not be voted on at that time with the outside section, but at the very least, it gets everybody's attention on that bill number. So those begin coming out, those bill numbers get assigned beginning tomorrow, or not the bill numbers, the amendment numbers get assigned beginning tomorrow. So we're excited to be able to get that information out. And we are looking for co-sponsors on that amendment as well. So that's where people can be of a big help and be able to ask their individual House reps and their senators to be able to sign on as that outside section amendment. But we're on a pretty good track for the wheelchair bill. We're further than we've been in years past. So we're hoping for a good outcome this year. Thank you.
Thank you, Destiny. And if you have the link and can drop it in the chat, Destiny recently shared a link with Caitlin and I. She had met with some legislative leaders and they worked on a special social media post to help bring more awareness about the issues of chair repair to the public. If you have that link and want to drop it in the chat, I'm sure people would appreciate seeing that. We really appreciate the creative approach you've taken to help make lawmakers more aware of this important piece of legislation.
Thank you.
Excellent. I think we can go to the next slide. Before we move on, does anybody have questions for Destiny?
I don't have a question, but I have a comment. Or maybe I should ask this question. Destiny can answer. You know, when you say you're looking for co-sponsors, what do you advise people in this meeting to do?
The big thing, I can put another link in the chat. First, it would be great if you signed up for our wheelchair repair email list so that we can get so you can get the updates as we send them. I'll put that in the chat too, because then we'll send out a blast email. And I see Barbara is going to come in and explain what can be probably helpful on this as well. She's one of our coalition members too. But when we get the actual amendment number, it would be really helpful if you called spoke to your individual House rep in particular and asked them to sign on to amendment number and explain why it's important to you. Are you a wheelchair user yourself? Does a family member use a wheelchair? Like, why does this issue matter? I do have templates and things that you can use, but we are asking people who have capacity to kind of make their own story or make their own phone calls. Those tend to go a lot faster, rather, or a lot better received versus like calls to actions where it's repetitive. So we do ask that each person tries to customize that the best that they can. And Barbara, do you have any other information on that too?
I really don't. You did a great job on that. I was just going to say that once the budget comes out and then the amendment processes happen and they're filed, even though the legislator that's filing the amendment has to do so by the end of the day on Friday, people can still co-sponsor, can still sign on to the bill into next week, right? Next week is school vacation week, and that is when Ways and Means will be looking at all the amendments. But people can certainly, it's not, there's no Friday deadline for asking other people to sign on to Jim O'Day's amendment.
Well,
Thank you, Barbara.
thanks to you both. So
Jennifer, I had my hand up for something different, actually.
okay.
Yeah, if you
Well,
don't mind.
I'll close out and then I'll pass it on to you, Barbara. So yeah, if folks want to let their legislators know that there's going to be this opportunity and share your stories about why this matters and how this would help remove barriers to people with developmental and other disabilities, that would be fantastic. Barbara?
Could you go back to Senate 866 in your slides? Okay, so this medically fragile children is really the continuous skilled nursing program. And I just wanted people to know that if they are having difficulty accessing the program, or if they are having difficulty not just with obtaining hours, but with the result that's given to them by filling out the form, we are actively taking continuous skilled nursing cases. So that can extend to the number of hours in the home that people are being approved for. It can extend to also to education and whether anyone is being finding it difficult to be included in their school, their public school. So anything that relates to folks that qualify for this continuous skilled nursing program can feel free to check in with the Disability Law Center through the intake department. I can't guarantee it's going to be subject to some, financial qualifications, but we are actively working on continuous skilled nursing cases for those family members who might be on this call for whom this is a concern. So we're doing the legislative, but we're also doing legal services for these families.
All right. Thank you so much, Barbara. I just dropped a link to the Disability Law Center in the chat, and I'm going to drop another little note here to say if you have difficulty accessing continuous skilled nursing services, contact the DLC. Is that okay?
Yes, that is okay. Thank you.
All right. Glad that you're here and you let everybody know.
Well, thanks. I guess we'll go right into state budget update. Jennifer.
Sure. Next slide. Let's talk a little bit about the state budget. Back in January, the governor introduced or submitted her initial state budget proposal for fiscal year 27. And then in April, the House Ways and Means takes it up, and there's some House debate, and the House ultimately ends up proposing their budget. In May, the Senate has their turn in the Senate Ways and Means Committee, and also Senate debate. And then they create a proposal for their version of the budget. In June, there's this thing called the Committee of Conference, where they work out differences in each version of the budget for the House and the Senate, and thinking also about what the governor has initially proposed. they come together and they present a budget proposal to the governor. And hopefully in July, the governor agrees with the House and Senate version of the budget and signs off. And we have a new state budget starting in July. So right now there's a lot of focus on the state budget, but now generally in January, it's when the governor does her budget proposal. April, the House is focused on it primarily, and then in May, the Senate has their turn at a budget proposal. June, they're working out differences and they're going to submit a proposal back to the governor, and hopefully she will sign it. She has several options. At the box at the bottom center, it says click here to learn more about the state budget process. If you want more details on that, you can click that there. All right, next slide. So now we know that the bill, if you were to go on the general court website for Massachusetts, you will notice that the little, I don't think you can see my pointer, but you see the orange writing in the left-hand column, House Ways and Means Budget. So I wanted to share a few things about this particular step in the state budget process. Oops, can we go back? There we go. So the House Committee on Ways and Means, they're going to study the governor's budget proposal. And then this committee will release recommendations for the House of Representatives to consider. The House Ways and Means Committee holds budget hearings across the state, and then the House Ways and Means budget is released. So that's some more information about this particular step in the process. There's a link in the slide that you can go to also get more information. Thinking back to the governor's proposal, you may recall that there were some positive aspects regarding funding for developmental disability programs. There are a couple of areas of concern as well. The governor's, the slides from the last Public Policy Committee meeting are on our website, and there's a breakdown in the slides about the positive funding aspects for developmental services, and then also some of the areas that might be of concern if you want to take a look and go back. You can also access the governor's full budget on the Massachusetts General Court website as well, and the link that's on this slide. It's still early-ish in the budget process, and we'll let you know more as the process unfolds. Next slide. You might be wondering, so what is the MDDC doing? We're still continuing to collect and share stories, and there's a link there next to the number 1 where you can go and you can share your story. Obviously, Medicaid is something that we're watching very closely with that reduction, that huge reduction that Elizabeth Lamontagne talked about during her presentation, the reduction in federal funding due to OB3, or the One Big Beautiful Bill Act. That's going to impact our state budget, and our lawmakers are going to have to make some decisions about how to use resources. And it's important for them to know why Medicaid services are important to you and your family. We'll continue to distribute some policy resources that highlight the importance of Medicaid-funded long-term supports and services and home and community-based services, also known as HCBS, and of course the workforce rates. And we'll continue to meet and collaborate with state leaders, lawmakers, and administrators to help ensure they understand the importance of these services and programs in Massachusetts. Next slide. What can you do? Well, it's always important to maintain contact with your legislator. If you don't know who your legislator is yet, that's okay. The link underneath number 1 will take you to the Massachusetts General Court website, where you can put in your address and you can find out who they are. You can contact them. They have these in-district events and sometimes meetings. You could schedule a meeting in their district. You could maybe make an appointment to meet with them at the State House to build a relationship. So knowing who your state legislators are really important. and we can help support you to do that. Caitlin, Liz, and I, we're here to help support your advocacy and help you to be empowered. Attend, this, I must not have updated this last bullet. In March, we had our 48th annual legislative reception. That was back on March 10th. And certainly we do this annual event each year in celebration of Developmental Disabilities Awareness Month. And we'll be sharing out information as we approach March in 2027. Wow, can you believe that? 2027 for you to attend then. But reach out to us if you're interested in, meeting your legislator, if you need some help or support to do that, or help to share a story. We're happy to share it with lawmakers and provide you some guidance to empower your advocacy. Next slide.
Okay, now for our coalition updates. You go next slide. So that's Tamara.
Hi, everyone.
Hi.
I just came from the PCA Workforce Council meeting, so I've got information hot off the presses. So I wanted to make you aware there's a public hearing on May 4th, and it's from 9 a.m. to 12 noon about the PCA regulations. And you can find out the information on the mass.gov website. And I just have a quick update. Mass Health has created a working group.
Excuse me, Tamara.
Yes.
I don't know if it's just me or if other folks, your audio is a little bit choppy.
Yeah, it is.
Oh, sorry. Is it better?
Still a little choppy.
Is that better?
It's still a little choppy, but maybe speak a little more slowly. And if folks have questions or if you miss something, you can raise a hand and Tamara will be happy to follow up.
Okay. So did you hear me about the public hearing on May 4th?
Yes.
Tamara, maybe if you turn off your video, sometimes that will help.
Is that better?
That's better.
Okay. So as I was saying, there's a public hearing on May 4th about the PCA regulations that are coming up on July 3rd. And I'll have more information on that, but you can find the public hearing information on mass.gov. And again, it's from 9 a.m. to noon on May 4th. Now, for other news, Mass Health has created a working group. This working group will make the Paperworker website more user-friendly and accessible for individuals that use the program. The purpose
Excuse me, Tamara. Do you want Caitlin to advance the slide?
Oh, yes. I'm sorry. So, as I was saying, they were wanting to make the Paperworker website more accessible for individuals that use the program. The purpose of the program, the website, is to replace most of the physical paperwork, and it moves all the required documentation online. And this project aims to help more people benefit from the system by making it easier and simpler to understand. And this website handles paperwork, taxes, payroll, and employment forms, so the consumer employer doesn't have to. And it just makes the process faster and easier to obtain. And it's usually run by the fiscal intermediary, and the fiscal intermediary is Campus Unlimited. So that's all I have for the update, and be sure to stay tuned in May because I'll have a more detailed update. Thank you.
And I think there's one more slide with some contacts, and I can drop those links in the chat if that's helpful, Tamara.
Yeah. You can also reach out to me if you have any questions at any time.
Does anybody have any questions for Tamara?
Okay, I think that's you, Liz.
Okay, so first of all, I have to say, some of you may have noticed I'm a little slower getting stuff in the chat. So if I'm dropping a duplicate information, my apologies. Okay, so RevUp MA is one of the coalitions that the MDDC is a member of, and it's based at the Disability Law Center. And it's a statewide coalition of organizations and individuals about voting rights. There's also a national RevUp chapter. So the coalition focuses on educating people with disabilities about voting rights, advocating for accessible voting, helping people to register, and encouraging civic engagement of people with disabilities. And RevUp actually stands for Register, Educate, Vote, Use Your Power. Next slide, please. So they've been meeting monthly for the past few months, but they're not going to meet in April. They're going to have a webinar on May 14th. I don't have the time yet. I think it's going to be in the afternoon, but I will add that information in the minutes when the minutes go out. And the webinar is going to focus on the voting rights for people with disabilities and other useful information on accessible voting in Massachusetts. And they're very enthusiastic about growing the coalition. So if you want to receive their emails and come to their meetings and come to their webinars, I'm going to drop this link in the chat so that you can sign up. And yeah, I know there are other people in this meeting who know much more about RevUp than I do, and they're free to chime in or not, but that's all the information I'm sharing for now.
Barbara, do you want to add anything?
Well, thank you for doing this, first of all, Liz. The RevUp webinar is going to be at 1 o'clock.
Oh, great.
It's going to go for an hour and a half. There will be CART and ASL because we're trying to, deal with every possible accommodation that might be needed. And the idea behind this is to do a number of things. It's really to begin to allow individuals and volunteers to feel empowered, to learn about how they can help. So first and foremost, really would be getting themselves registered and having a plan to go vote. But we're also trying to, because we have one full-time voting advocate, and there's a whole big state. So the idea behind this webinar is to kind of train people about how to register and whether or not they would like to register other people in their, daily work that they're doing or as a volunteer. It will also talk about accessibility once you've registered if you are going to a poll. So what that looks like in terms of physical accessibility outside a polling place with parking and, the grade of the sidewalk and the heaviness of the door. And then once you get in the door, if you need to use the automark machine, we'll talk a bit about that. But we're also going to talk about our state. You can register through the Secretary of State to vote at home. If you meet certain criteria, if your fine motor doesn't enable you to fill out the little circles, if your physical state would make it very difficult to get out to a polling place, if you are blind or low vision and need a screen reader. So many people can actually vote from the comfort of their own home on their computer if they apply for that. So we'll talk a little bit about that as well. And then we're also going to talk about how we're trying to reach out to people being in institutional settings. So that could be nursing homes, could be hospitals, could even be jails. It could be in group living environments, like if people are, in group homes. or in day programs. So we're really trying to cast the net as wide as we possibly can. And I will say that I was on an Institute for Community Inclusion meeting earlier today. I feel like on Rev Up, we have a very high number of people that come from our independent living centers, but not so many people that come from this community. So I just want to be sure that people know they're welcome to join, to be a part of this, and to whatever degree they're interested, be it getting themselves educated and registered, or coming up with a plan to vote, or helping others in the circles that they are in. So that's really the intent of all of this. There'll be other webinars getting closer to the fall elections, but that's the idea here, is to kind of educate and empower the people that join Rev Up to go out and do some things to make sure that we have, as many folks with disabilities registered and able to vote as possible.
And I actually want to add, so at the last Rev Up meeting, there was a conversation about the AutoMark machines. And for those who don't know, these are machines that when you go to vote in your local voting place, every voting place in Massachusetts should have one. And they make voting accessible, perhaps for people who, have low vision or other disabilities. So I had a local election in my town recently, and I used the voting machine. And it was a good experience and a good conversation with the polling people, and something that not everybody knows about, but that anybody can do that. You don't have to have a disability to use that machine.
Okay, I think that's it. So, is Lee here to talk about this?
Yeah, Lee, I think you're here. I'll start off by saying, for our Guardianship Alternatives Innovation Network, this is a coalition that's led by the MDDC, and the focus is on guardianship alternatives. We have a doodle poll out there among our members, and we're almost ready to set our May coalition meeting date. That's to be determined. I'm so grateful that my colleague Lee LaRue could be here today. She has some exciting information to share about something that's being planned for May as well. Lee?
Yes, thank you so much, Jennifer. So the MDDC is proud to support a panel discussion called Mysteries of Guardianship Alternatives. So the GAIN training team subgroup is putting this all together, and they're in the process of finding both experts and people that are going to be talking from lived experience. So we just recently put together a post that will be officially released tomorrow. This is going to be about a community conversation about people who live it, who live alternatives, who live all different ways with support. This panel introduces essential terms, is going to explain alternatives to guardianship, and will explore how we can support self-determination at every stage of life. So again, we're going to have lived experience advocates. We're going to share clear, accessible explanations, and we're going to provide a supported space for learning. So our date is going to be May 20th, and I can put this in the date so you can, in the chat, so you can say the date. So May 20th at 6 o'clock until 7 o'clock. And then there'll be a Q&A from 7 to 7:30. And again, we'll have all of the registration links, and we will be sending that out to our partners as well. So they will be spreading the word.
Thank you so much, Lee. We appreciate you coming today and giving us an update on this. Really excited to have this panel and help to educate and inform the greater disability community and other people beyond our community. All right, next slide. I am so excited to also welcome another Generational Leadership Summit graduate today. Benji Kemper has also been a summit presenter and is a very important, powerful force around housing advocacy. And he agreed to pop in today to share some really good news about something that happened with the Qualified Allocation Planner, what's also known as the QAP. I'm sure Benji will explain a little bit more about what this is and what happened and what celebration is being planned.
Hi, Jennifer. Thank you so much for that introduction. So I'm just so excited to be here. We've had around like a 2-year campaign, and you hear all these campaigns, and you're like, why do we do this? Why do we do all these? It's because sometimes you win, and it really makes a big difference. And so, um, working with these generational leaders from the Spooner Summit, we were able to get it so that we realized that accessibility is a big issue and accessible, affordable housing is a big issue. So we got there's this thing called low income housing tax credits, and it creates the most amount of affordable housing in the country. And we got this, each state can decide how to allocate their plans, how to divvy up the funds, who gets the money, who doesn't. And um we got them we got the state to say in that plan that if the project is 10 u units or bigger and has an elevator, it has to be 10% accessible. And that is it's a huge leap in accessibility. And not only that, but it alters a bunch of other funds, including the State Affordable Housing Trust Fund, um, to that same, if there's 10 or more units and an elevator, it has to be 10%. And there's hundreds of millions of dollars in the Affordable Housing Trust Fund. So this is a huge win. We're planning a celebration. We don't know the date yet, but we'll get it out to you as soon as possible. And we really hope to see you there so we can celebrate together.
And
Thank you.
Benji, is there a link maybe we could drop in the chat? I was just going to put a little plain language definition about what a QAP is. It was from the CHAPA website, but I put that in there just for folks who might be learning about a QAP for the very first time. And I don't know, is there a link you think we should share in the chat? And obviously,
I have a definition that I can share with
okay,
you.
sure. Does
Thanks so
anyone
much.
have questions for Benji about this exciting development around housing and the qualified allocation plan?
I guess I'll just ask. I'm so curious. I know accessible housing is often for physical disabilities. Does that include accessible for like people who are deaf, hard of hearing? Sometimes they have special lights and that kind of thing.
No, this is just for physical disabilities.
All right.
All right,
Should I?
well, thank you. So now we'll go to the federal update. Back to you, Jennifer.
All right, next slide. So, as you might have heard in the news, President Trump has issued his federal fiscal year 27 budget request to Congress. It would start in October, or the new federal fiscal year 27 budget is supposed to start in October. You know that we've had continuing resolutions because Congress, has taken a longer time to be able to agree to a federal budget. I will say that the budget has some very large increases in military spending. It also has some pretty deep cuts to what are known as domestic programs, things like Medicaid and Medicare. I want to emphasize that while this might be alarming to the developmental disability community, the president's budget really is a wish list for things that his administration would like to see in the budget. If we think back to last year at this time, The president's budget request was much different than the federal appropriations that were finally signed into law. And Congress, last year at this time, there were some proposed cuts or eliminations of programs that are important to people with developmental disabilities. And if you recall, Congress said, no, we don't want to do that. We're going to do this. So it's very early in the process. The federal budget process starts with the president's budget requests, which he has just submitted in early April. I think it was like on the 1st or 2nd. And so there's a lot that will happen between now and then. Congress is going to take up the budget next, and it will create a proposal. There is a link at the bottom of this slide to a Disability Scoop article. Their articles are very readable, and I thought that this would be a good resource for people who are looking for more information. The big question will be, can Congress and the president agree on a budget, or will we end up in another continuing resolution like we have the last couple of years? And I have a definition, a simple plain language definition there on the left. Basically, a continuing resolution is a temporary funding measure. It's used by our government, our US government, to avoid government shutdown when the regular appropriation bills are not agreed on by the start of a fiscal year. So I don't know if that will happen. Again, we're at the very beginning of the process. The president, the beginning of April, has just issued his budget request. There are some changes. He would like to see big increases in military spending and make some deeper cuts to the domestic programs. Remember, it's just a wish list. Let's go to the next slide. A couple of things I thought I would point out about the president's budget proposal that he just submitted to Congress, his wish list. This proposal would eliminate developmental disabilities projects of national significance, would eliminate university centers for excellence on developmental disabilities, the UCEDs, we have 2 here in Massachusetts, and voting access for individuals with disabilities program. Again, this is just the president's wish list for where he thinks our priorities should be. What we do know is in the development of this last federal fiscal budget, Congress had different priorities. Initially, the president's request to Congress last year at this time wanted to eliminate UCEDs, and we know that Congress said no, and UCEDs did get funded. I don't have a crystal ball, but given what we know about Congress's priorities, I anticipate that the final federal budget appropriations will look somewhat different than the president's wish list or the president's request to Congress. Any questions about this?
Jennifer, if I could just add one thing.
Sure.
If there's anyone on the call who's interested in learning about these different projects or organizations, let us know, because sometimes I think people don't know what affects them and maybe their organization, their lives, or their advocacy work. But for example, our DD Council, of course, works very closely with our DD network, the University Centers for Excellence in Developmental Disabilities. We also regularly use data and evidence that comes from developmental disabilities projects of national significance. So sometimes when we think, oh, if we lose one thing, it's just one thing. But actually, when we lose some of these if these things were, I'm not saying they are, of course, as Jennifer pointed out, if these entities were to lose funding, it also makes it harder for us to do our job. So it is kind of something that affects most folks in our developmental disabilities community, even if it's, not DD councils on the chopping block or protection and advocacy agencies. These are entities that we work very closely with and help us be more effective and efficient at meeting our mission for the community. So I just want to put that out there, Jennifer. And if people have any questions again about examples of projects of national significance or examples of our USEDs, like what ICI is up to, we'll have our partner updates, but please feel free to ask us questions about that.
Absolutely. And I wanted to point out the link at the bottom of this slide will take you to a Disability Scoop article that was a follow-up after Congress did pass federal appropriations for developmental disability programs. And this one was about how Congress is like, no, we're not going to cut that. We're going to support these disability programs. So I didn't want anyone to feel too alarmed or too panicked. This is a process. It's the very beginning of the process. I will say that the National Association of Councils on Developmental Disabilities is doing intensive and intentional work to educate and inform members of Congress about the importance of DD programs and the USEDs and our other DD Network partner work. In fact, they had sent around a Dear Budinsky House letter around appropriations for support of these programs. And we had record number of signers this year. And this is something that they've done, NACDD has done in for many years. There's a Senate letter that will also go out. And we're really hopeful that there'll be a lot of Senate signers as well. So there's a lot of work on the national level, not just on the part of NACDD, which is that umbrella association for all of us DD councils, but other leading organizations too, to educate and inform members of Congress about the importance of these programs. And I'm so glad that you added that, Caitlin. The president's proposal does a lot of other things, but I'm just going to leave it at that for now. And because we've had so much information today, and we'll keep you informed as the process plays out. Next slide.
Okay. Whoop. Can I go back one?
Yep. Sorry, Jesse.
That's all right. Council and community events. And we got a little preview of the disability policy seminar. So you can go to the next slide.
Caitlin, do you want me to speak to this, or do you want to speak to this?
I can speak to this. I also know Tatiana's on the call, and she was interested in sharing a little bit as well. So Tatiana, I will just introduce what this event is, and then we'd love for you to share out your experience too. I don't know that Austin's on the call, but
No,
if
he had to leave.
Okay, that makes sense with timing. So Tatiana, I'll do a quick introduction, then I'll hand it over to you. Does that sound okay? We've got lots of pictures that Jennifer put together for us. So 2 weeks ago or 3 weeks ago, Jennifer, myself, Tatiana, and Austin attended the Disability Policy Seminar in Washington, D.C. This included a seminar where we got to learn about some of the biggest and emerging policy issues affecting the DD community. And we also had the opportunity to do Hill visits to kind of amplify and educate from our DD Council perspective, educate and inform about how some of these policy issues were affecting us in our lives, as well as our community. Tatiana, why don't I click to a picture page, and then do you want to share a little bit about your experience?
Also, in fact, me and Austin and Caitlin and Jennifer, we had 11 meetings on the Hill.
That's true. So these photos, I guess, are from our first seminar day. On the left is a photo of us with folks from other DD councils all over the United States.
Also, that's also in a newsletter that one of the fabulous organizations that Jennifer mentioned it's in the fat photos out there.
Yeah, so we're featured in their newsletter, which Tatiana, I think, is well deserved given all the work you did. So this is some photos from our Hill visits. Tatiana, why don't you talk a little bit about your experience with the 11 Hill visits that we did to meet members of
So it was great. So as you can see, me and Jennifer actually got to meet Congresswoman Ayanna Presley, who is actually my congresswoman. So we actually learned that she supported the bills for like Medicaid, all those healths, and I actually met her a couple of days ago, and she said that she's gonna use our stories.
Yeah.
Most of them, Senator Elizabeth Warren has the education feedback in her when she became senator, so they're gonna use our stories and reach out to us for them. They can actually use us.
Yeah, Tatiana, so why don't you share a little bit about what happened in the meeting? So we would
Sure.
would meet with a representative or someone from their staff team, and what did you share with them?
So me and Austin got to show passion why we're here. We actually got to share our Medicaid stories, our PCAs, our education, our workforce. And actually on the bottom, we got to meet with the Congressman McGovern. We got to go out in his hill, backyard, and meet with someone that we met with for the Medicaid story. And he actually asked us, are we doing his job that he asked us? And we said, keep on fighting. They will all continue fighting for us.
Yeah, that's a great point. So you mentioned meeting with Representative McGovern, and I can say as someone who attended, that Tatiana and Austin really did such a wonderful job sharing their personal stories and communicating about how their personal stories related to different policy opportunities, that the representatives and senators could be aware of, and providing examples about how some of these policies can affect the lives of people with developmental
In fact,
disabilities. Families.
Congresswoman Ayanna Presley, also Congresswoman for Winthrop, actually gave us the private passes to go underneath the tunnel. So we actually got the opportunity to go listen to what our Congress and our House was saying about like the team, like in there.
Amazing point. I'll go to the next picture because um what Tatiana is alluding to is that we had some really successful meetings. We made some great relationships, and we were invited by two representatives to go
Congressman,
have
I mean Congress, Caitlin.
yes, two Congress people to go tour and listen into a bill session in Capitol Hill. So we got to go
Also, the fact
there.
Congresswoman Ayanna Presley actually has a new bill out there for safety for fire drills.
Oh, okay.
Yes, she brought up how
Her state
listening.
legislation brought that up to us. So
Mhm.
that's something different that we don't know.
Yeah, so that's such a good example. Tatiana, she shared an example of how she learned stories and looked at other states where students with disabilities did not have good plans when there were fire drills to be able to evacuate buildings safely. Her and her team took those stories seriously and are working to propose legislation that would make evacuation plans accessible and inclusive, across states. So, very good example. Here's some more photos, and we've got one more thing of photos. So the middle one is Tatiana and Austin in Capitol Hill. The one on the left is Austin when we were going in the tunnels to go between the House and the Senate side, and we were going between these different buildings to meet people. Um, and then yes,
Also, we met the guy that's running against Senator's team, Ed Markey. And Senator Ed Markey, Jennifer did tell us that Senator Ed Markey is still running.
yes, so I think that Senate races are unfolding. So we did definitely get a front row seat to the politics of Washington, D.C., and learning that there's multiple people on the ballot who could be our representatives in the coming
We
cycle.
also got to have a sneak peek at a congressman for Brookline because we were blocking his way, so we actually moved for
Yes.
him.
It was very hustle and bustle. We got to meet a lot of people. And again, Tatiana and Austin did a fantastic job representing the DD Council. And it was a busy and exhausting and very successful trip. Jennifer, did you have anything that you wanted to add?
I love this particular picture of Austin in the bottom left where it says our house. And if you were to zoom in on him, you can see his finger pointing to the sign behind him because,
Hmm.
it's so important for advocates to know, like, you're the experts, and our delegates, they work for their constituents, they work for us. So I love how he's pointing like, this is our house. And I love this picture of the two of you together, Tatiana with Austin. This is in the Capitol itself, on Capitol Hill, where they were able to receive special access to a House session, I guess.
A bill
Yeah.
session.
I would, if you don't mind unsharing your screen, I thought I'd quickly flash a couple of the Hill documents. So in addition to Tatiana and Austin sharing their story, we talked to a lot of upper level policy people. We talked to some delegates directly, but we wanted to make sure we had some materials to leave with them so that they would remember who we are and what we're doing. It's hard to talk and share
Also,
my
in
screen.
one of the documents, they don't know about the MDDC council, so it was explaining what we do in the
Right.
council.
Yeah, so can everybody see my screen and you see Austin's?
Yep.
Everyone can see that? Okay. So here's Austin's story that we included in the Hill Visit folders. And it's just a visual resource to leave with policymakers. They remember him, what he looks like as a person, and his story. He talked a lot about the importance of funding for DD programs that help people with DD and their families across their lifespan. He talked about how important his Medicaid, home, and community-based services are in order for him to live his life. And also, he talked about programs that helped empower his advocacy that were funded and offered by the MDDC, and how that led to establishing a really important nonprofit to help increase social opportunities for people with developmental disabilities in their communities. So that's Austin's. I'm going to switch tabs. Can you see Tatiana now?
Yes.
Here's Tatiana. So we also shared Tatiana's story. Tatiana talked a lot about not only the Medicaid, home, and community-based services. We're most concerned about these with the reduction in federal funding because they're not required federally, and states don't have to fund them. So when the state is making some difficult budget decisions about what services they're going to fund, they need to know why these are important. Tatiana also talked about her inclusive educational experience and how that supported her to transition into her adult life, work, and competitive integrated employment. And so she also talked a little bit about IDEA, Section 504, and the importance of the Department of Education. I'm going to click to the next tab here. We also talked to lawmakers about the Social Security Income Restoration Act. This is being introduced by Elizabeth Warren, Senator Warren, and it's really aimed to update and strengthen supplemental security income program. We also touched on, again, we had a whole fact sheet dedicated to HCBS, home and community-based services, about what they are, how they help people to thrive in their community, how many people in Massachusetts benefit from these services, and so forth. Finally, the last thing I'll mention, there were some other things that we talked about, but we also talked about an important bill around employment, HR 4771. It's the Transformation to Competitive Integrated Employment Act. And we talked about how this legislation would help phase out subminimum wages and help support people with disabilities to transition to competitive integrated employment opportunities and leave sheltered workshops. It talks about the expansion of training and services and how this legislation promotes inclusion for people with developmental disabilities. So I'll stop sharing. Thanks for your patience. We're going to put these materials on our website so they're available, and we're going to use these resources as well on the state level to advocate around the budget, the state budget, and the importance of these programs and how they support individuals to live inclusive, meaningful lives.
Okay, so, well, I want to thank everyone for joining to celebrate Developmental Disabilities Awareness Month. A lot of you were probably at our annual 48th annual reception, which we hosted with the ARC, in which we recognized two legislators, uh, Joan Lovely and Jay Livingstone, and that was a great event. I'm glad all people came there. And do we have any pictures from that event? Or no, we don't have pictures from that event. Okay,
I
let's
don't
go.
have pictures today, but if you go to the link at the bottom, I believe Jackson put some pictures on our website. And also, if you follow us on social media, there's a gallery of pictures from the event there as well.
Yeah. All right, thank you. Next slide. Okay, who wants to talk about the 5-year plan? I think that's you, Caitlin.
Sorry, everyone. Sometimes when I'm sharing my screen with the slides to toggle between muting and unmuting, it takes a minute for things to pop up. I know Liz is also on the call, so Liz, please feel free to chime in. But we have been working together with the whole GD Council team has contributed on our 5-year state plan. So we are currently in the process of refining a new survey that we're going to send out for community input. This survey is based on the feedback we got during our focus groups. We've also worked closely with our state plan committee, which consists of different council members, to inform this. And Liz recently worked with our training team to get excellent feedback to really help us shape and make some changes to the survey that we hope will make it easier for people to take and help us get the information that we need to finalize some of our goals and objectives for this 5-year state plan. So really, this is just an update that we have been working hard behind the scenes. Please keep your eyes open. We'll probably be sharing this survey out soon, and we would love for everyone to take it and share it with their networks. Liz, sorry if I spoke for both of us. Do you have anything that you want to add?
Now I'm kind of laughing. There's another slide, but I'm kind of laughing because you're faster with unmuting than I am. I feel like just there when you started speaking. So
Every time I went to try and get my toolbar, it would disappear, the muting. I'll go to the next slide, and if there's anything, maybe you can speak to this about how the survey, we can provide support for folks.
Right. And as Caitlin said, coming soon. We hope it's really soon, but yeah, we're still revising it and we are going to translate it into Spanish. But when the survey goes out, it's going to be online. It's going to be on SurveyMonkey. But if people have difficulty with that kind of, taking a survey in that way, Caitlin and I were very happy to either, set up a Zoom meeting and we can fill the survey out for you, or even meet in person or do it over the phone, or, let us know if you have issues with accessibility, that the SurveyMonkey doesn't work. We want to work with you and make sure that you give us, your opinions and, tell us about your experiences. So we'll do what it takes to get your input here. We hope it might be a little long, but we've actually shortened it quite a bit. But we do hope, it's very important to get your feedback because that's going to determine our work over the next 5 years. So we expect to do this in, sometime in April into May. And we will be announcing it. If you're not on our mailing list, there's a link on our website where you can sign up for email updates, and also Facebook and Instagram and I guess X and LinkedIn maybe. We will be posting when the survey's ready, and you can find the link there. Are there any, well, I guess if there are any questions, you can let me know.
Jossie, before we go into partner updates, I wanted to also just another shout out. There are a lot of people that you don't necessarily see in the front facing part of this meeting, and I want to say another sincere thanks and appreciation to my colleague Jackson Crilly, also our colleague Christine Joel, for their support to make sure that everything was working on the tech side of things today. Jackson also, he's the one that creates the registrations so that members of the public can attend these meetings and have access to the information. He also created the survey and the survey link, and I'm just so grateful to work with so many talented professionals and with people who have such a great attitude and team mentality. So thank you all.
All right, appreciate that. So now for our partner updates. I know we have some partners on the line. I know Barbara from Disability Law Center is here. I know David from ICI is here. Who would like to share some partner updates?
Well, I would say my biggest update I already covered, right, which is the Rev Up training on May 14th. However, we're also doing pretty intensive training on this Friday. It's really mostly aimed at educators in the public school system. There'll also be perhaps parents there, but it's really to put a light on the new regulations that have happened with regards to timeout and seclusion that really happens among folks that are still in the school system. And so we're doing that. We had enough individual cases coming to us that were cause for concern that we started trying to work on this systemically, and we're able to get a seat at the table with the Department of Education and able to influence them to rewrite their regulations so that people, young people with developmental disabilities cannot be left in a locked or closed door situation for hours on end. So we were able to get some funding to be able to help school systems get an expert to train. And so this will sort of go over the updated regulations and what, some of the best practices are. So I realize it might really affect more people younger than those on this meeting, but it's important to know within the DD network, right, that we see issues pretty regularly with young people that are of school age that are being subjected to timeout for extended periods of time or seclusion or even use of restraint. So that's sort of what we're getting at. But if anyone wants to kind of be apprised of the different things that we are doing, that or the Rev Up or any other things that we're doing, I would really suggest going to the website and signing up to be on our mailing list.
Thank you, Barbara. Any other updates from our partners?
So this is David Ha from the Institute for Community Inclusion. Not a whole lot, but a couple quick things. We have been looking at, we're applying for some funding, particularly looked at working with keeping older adults with intellectual developmental disabilities in the workplace. So we're currently just proposing, these are just proposals, so we don't know if we'll get it, but it's an interesting area that we're continuing to take a closer look at because it's frankly an under-resourced area and not as much attention is being paid to that as we would like. The other thing I'll mention that just on a kind of our own logistics, internal logistics, we are in the process of hiring a new director. We have 2 finalists. They've done final interviews. We hope for an announcement. I'd love to have an announcement by early May, mid-May, hopefully at the latest, about our new director. So stay tuned on that. But that we're very excited about that as well as, Cindy Thomas retiring, and we've had a temporary director. So it will be this will be somebody also who will get engaged with the DD Council and all the work that all our partners are doing. One other thing, I'll just mention this real quick. I did a webinar. I thought it was interesting. First, I appreciate the state budget update, Jennifer, and it does seem like the House is taking their time to get their budget out there. I did a webinar last week focused on the employment line items in the state budget. And one of the findings, and we had a discussion about it on the webinar, and I think this is true of a lot of line items for people with disabilities, so many of them are buried in like much, much larger line items that it's really hard to get a read. In this case, we were looking at employment funding. It's really hard to get a read at times in terms of what is the state spending their money on in terms of disability specifically. When you've got giant line items that talk about, for example, community supports, it's pretty hard to figure out, okay, what does that mean for people in terms of specifically for employment in the community? And that's just an example. So I just think it's an interesting issue. Obviously, I think 5 minutes to go, we probably want to go deep on that, but just food for thought maybe for this group and in general, because transparency on what the state is spending on disability is really, really critically important. The good news is everything's online, But the not so good news is really getting beneath those larger, line items takes some digging. So just a thought. It's pretty much, it's what I've got.
David, may I suggest when our survey comes out that you fill out our survey? Include that
Yes,
information.
yes, yes.
David, I'm
Thanks.
so glad that you shared that and you commented. Yeah, there are other items in the state budget where we have similar experiences. The self-direction line item is combined with a lot of other line items, so it's really hard to know like how much is going and how that's changed over time from one budget year to another year. It's really hard to like untangle that. So I hear what you're saying.
Yeah. And I think, again, part of advocacy is saying to the state, recognizing the complications of budgets and all that, but, state agencies should be able to make that information more readily available. So, but thank you, Jennifer.
Yeah, thank you. Is anyone here from the Mass Office on Disability here or any other of our partners?
Hi, this is Camille Carabite from the Mass Office on Disability. I have a couple quick announcements I can share. If you are interested in our community access monitor training, this is training that teaches about the building accessibility regulations and how you can be an advocate in that area. We do have trainings scheduled for June, August, October, and November of this year. So there's lots of opportunities to get involved with that if you're interested in learning things like the slope of a ramp and like how you go about measuring different types of building features to make sure that buildings are as accessible as they should be. We also have our municipal ADA improvement grant that opens May 1st. So while this is not something that individuals can apply for, it is something you can certainly talk to your local government about and see if they're planning to apply or if they have any good programs that would improve accessibility in your area, in your city or town. We have information about that on our website as well. I can drop all of the links in the chat. And finally, we do have our statewide Commission on Disability meeting tomorrow from 1 to 2 p.m. And there's going to be another one in October. So these right now are just for people who already are members of their Commission on Disability. And those are city or town commissions that kind of serve as the go-between between the public and the local government. So if you're involved in one of those, you can come to that meeting. If you're interested in learning more about commissions and seeing if your community already has one that you could join, or if you would like to potentially start one in your community, we have information on our website about which communities already have them and more about how you can get them started and those types of things. So I'll drop all of those in the chat.
Well, thank you. And David Hoff just mentioned that in Melrose, his group has his Commission on Disabilities had great success in getting MOD grants.
Thank you, MOD. But I really encourage folks, if you're not connected, we talked about this before, your local disability commissions. I know, Jersey, you're on yours. I think some other people on here might be on them. They're really great and entities to connect with.
Okay, I don't see any other partners here. Are there any other partners here that I'm missing that want to say something? Okay, I guess not. So we can go to the next slide. You want to take that, Jennifer?
Jennifer just dropped the link in the
Oh yeah,
chat.
for the
I
poll.
was not unmuted. See, Caitlin, and I'm not sharing my screen right now. Yes, so thank you for coming. Your feedback is really important. When you leave, please respond to this very short poll to let us know what we're doing well and what we might be able to do better. Really appreciate. Anne said also in the chat, Jossie, I just noticed, no updates. Thanks to all for this informative meeting. And thank you, Camille, for dropping the mod information there in the chat as well. I also want to thank you, Jossie, for your leadership.
Thanks.
And all that you do for our council and serving as our public policy committee chair. These meetings would not happen if it wasn't for your support, your expertise, and your guidance. So thank you for all that you do.
Well, thank you. Thank you. Okay, now it's time for anyone who wants to make any public comments. Again, you can raise your hand or someone will be watching a chat. Does anyone have any public comments?
Can I just ask a question because I had to hop on a little bit late? Are you going to share the slides from the Mass Health presentation? Because I got on just as it was wrapping up.
Yes.
Yes. Oh, go ahead.
Thank you.
Yes, they actually have they have to get prior approval to record the meeting, and we didn't realize that, so we could not record her presentation, but she did say we can share the slides.
We'll be sure to ask well in advance in the future when we partner in that way.
Yeah, that makes sense. Any other questions, comments, reflections?
Just on that note, another reminder, as people review the slides, if you have outstanding questions or things you didn't understand or things that you want more information about from Mass Health, we will work on that direct line of communication with Elizabeth. So please feel free to review the slides and just think about other questions you might have. I know that, we might have some, so just please feel free to communicate that as well.
Okay. All right. Well, this is basically towards the end of our meeting. So our next meeting is on May 12th.
Oops, sorry.
That's all right. Then you can see we meet again and we take June and July off. We meet in August. Then we meet in October. And well, the second Tuesday is Veterans Day. So in November, we're going to meet on November 17th. So, and of course, these meetings are always open to the public. And we look forward to seeing you at future meetings. Well, actually, first see you in May. So with that, I think we're adjourned, unless there's anything else someone wants to say.
Thanks
I know
everybody for all your time for coming.
yeah, thanks. I know it was a long meeting,